Hello, I'm Sharon Weber from University of Wisconsin. I'm here with Ann Lador and two of our inaugural International Junior Surgeon Travel Exchange Program recipients, Dr. Daniel Soar from Brazil and Dr. Nabil Zuffer from University of Wisconsin. And just by way of introduction, this is an award that was just started for the first time in 2023, developed by our Giving Back Committee and the Early Career Working Group, and really designed to allow paired surgeons to compare early career experiences with regards to building a clinical practice, sharing innovative techniques or practices in the operating rooms, sharing research portfolios and techniques, and transitioning into the role of an educator. And they've really been encouraged to also collaborate on at least one research project. So we're delighted to be here today and just talk a little bit about the experience of Dr. Zuffer and Dr. Soar at University of Wisconsin. We do also have two other 2023 recipients, which is Dr. Timothy Newhook from MD Anderson and Dr. Rüdiger Braun from Germany, University Medical Center, Lübeck, Germany. And then in 2024, there are two women, Alex Roach from Indiana University and Nashiva Kavuyo, sorry about that, from Tanzania. We will start asking some questions, and Ann, maybe I'll have you lead off questions for Dr. Soar and Dr. Zuffer.
Okay, well, thanks everyone. I think this was so far seems to be a really great opportunity, and I hope others will consider applying for it. So I'm going to start by asking Dr. Soar a question. So tell us why you decided to apply for this award.
So first of all, I would like to thank the SSAT for the award. It was like a huge moment for both my personal and professional life. So I'm very excited to be here with you all today. So when I first found out about the award, it struck me as the perfect opportunity to meet new people and actually to be more active in the SSAT and to meet new hospitals and to see how the life of a surgeon and a researcher is in a country other than Brazil. So that was in my head when I applied, and that were my thoughts to understand how research and how surgery is performed in another country.
And Dr. Zuffer, why did you apply for the award?
Yeah, very similar aspirations there. I have a big interest in global health and specifically global cancer care and cancer surgery, and I want to see how cancer care is provided in different countries, and in particularly countries that have less resources than the United States, and what we can learn from different ways of doing kind of this, treating the same disease process, if you may. And then so I wanted to see how things are done, but also have the opportunity to maybe develop some academic collaborations that we can take further and get into the realm of understanding and learning and doing some research to see how we can make cancer care better in different parts of the world.
So just to be clear, Dr. Soar has traveled to University of Wisconsin. We had a lovely visit, and Dr. Zuffer is traveling to Brazil
next week.
Oh, great. Okay. So Daniel, what were you hoping to get out of your visit? And just give us a few of your highlights.
So I was looking forward to the trip from two different perspectives, from a scientific perspective and from a surgical perspective. So from a scientific standpoint, I wanted to understand how research is performed by a surgeon in another country other than Brazil, and actually to compare it with what we do here in Brazil, how research is performed in a university in US, and to compare it with what we do here in Brazil, especially in the oncological field, in gastric cancer, and from a surgical perspective, to observe how the daily routine of the surgical center, including structure, procedures, number of daily procedures, or something that I think every surgeon wants to understand and to see how a surgical center works in another country and another culture. So that was what I was aiming to, and doing that to approach both universities. So in a scientific perspective, to approach the University of São Paulo here in Brazil to the University of Wisconsin.
What were your favorite things about coming to Wisconsin?
So everyone was very receptive. So I was treated very well all the time. So Christine gave me a ride from Chicago to Madison. Kalim helped me within my first few days. And I must confess that Nabil kind of spoiled me during the week. So he arranged things from schedule to food to my daily ride to the hospital. So I must confess that I had a hard time coming back to Brazil, where nobody spoils me. Also, the weather was really fine. It was warm, something that was not expected for that period of time. So I didn't have the opportunity to experience the cold of Madison, but the week was quite intense. So in the end, I had 10 one-on-one meetings with different staff, surgeons, researchers, oncologists, visiting professors. So I had, those were moments of great exchange of ideas and perspectives. And I was always trying to make partnerships for future research, something that we are trying to do at the moment. Also, I had the opportunity to observe some surgeries at the OR, so laparoscopic gastrectomies, duodenopancreatectomies, so to get a taste of the daily routine of the OR. Also, I walked around the university and saw the atmosphere, the university's atmosphere. That was something very nice. And I also gave a presentation in the oncology grand rounds, presenting some insights of gastric cancer within Brazil.
Nabil, what are your thoughts about what you hope to gain out of your visit?
Yeah, I'm very excited. One is we've been talking about it for a while, and Daniel's trip was just so awesome. Oh, Daniel came to our house. We had dinner. Our kids are the same age, so we've become some good friends over the past few months as well. So I'm looking forward to see the chance to see Brazil itself as in the country, the city, Sao Paulo. We've arranged a visit to the cancer center and spending some time with Daniel at the 2 different hospitals. When he came here, he did share a little bit of some teaching nuggets that he does with the students that are a little different than what we do here, and that'll be good to observe, like how he observes how they are performing in different cases and then gives them feedback afterwards, like how the residents and students did at a forum. Then we've already started working on some gastric cancer research, and I've looked at the data, we've analyzed it, but I don't know where the data comes from or the environment it comes from. So having a better understanding of the environment will really help a lot. And we are going to Rio as well, which is kind of an addition that we created ourselves to visit the National Cancer Center as well, and some collaborations there may emerge from that. So kind of excited to see how Cancer Care has provided the cities and then advance our collaboration.
Right.
Daniel, is there anything that you learned here in Madison that you think you're gonna incorporate down there in São Paulo?
So I would say that research structure is more favorable in US. Something as I can see, you have more people to work together with the surgeon, so that might encourage the surgeon to perform more research. And something that I saw, that I learned, is the protected time for research, something that is not as common here in Brazil. So research is seen here as an additional thing, like an extra hour. So we could work, that is in my head, to work on to apply some protected time for research. I think that it's cultural, but it's something that we could apply in the future. Regarding surgery, I think that after all, there are not so many differences. As I could see, the laparoscopic gastrectomies, duodenopancreatectomies are performed very similar. So I think I learned a lot regarding the research structure that you have over the US.
And maybe just one last question, Nabil, what did Dr. Zor bring to your institution that you might be able to put to use yourself?
Well, he did bring me a very nice Brazilian football shirt, which is from the famous team. I really appreciate that a lot. So that was a great touch. I think the just different perspectives on approaching patients throughout the care of their cancer, and just talking through the challenges with late presentation, and then how do you manage patients more in that category. And then we did talk a lot about research as well, and how to set that up in an environment where we're not so spoiled that to have protected time and resources and money and all these things that we can do it. I did like Dr. Shore's enthusiasm of being involved in surgical societies in the US, and learning from those experiences. So I may lean on him a little bit, Dad. And like I alluded to before, he has a very interesting teaching paradigm. I think that is something that we can definitely learn. Well, but a lot of my learning is going to be in a couple of weeks as well.
Yes.
See how he does things there.
Well, we look forward to hearing about your trip, and I think this was a fantastic first foray into this exchange program. Daniel, we loved having you at University of Wisconsin. Your talk at Grand Rounds was very well received and really well done. And so I just really encourage those who are thinking about doing this to apply, and also to just think about creative things to do, like your sacred time with Bucky that we saw pictures of. We should be flashing that picture up right now. So any parting words by anyone as we wind this down?
I will say that Danielle did spend some time with some of our residents and students, even our visiting students in our underrepresented in medicine program. And I think the perspectives of those interactions with how surgery and surgical care and cancer care is done in Brazil is really important for our trainees as well to understand and receive. So I think all of them appreciated interacting with you as well, Danielle.
Well, I think I would just want to end this off by saying, I do think this is an amazing opportunity, people getting to meet each other that you'd never have an opportunity to otherwise, get to experience going to a different country, giving grand rounds at a different location. And I really encourage anyone who's watching this to consider applying themselves.
Fantastic. Thank you both for being here.
Thank you.
Thank
And
you.
congratulations on your award.
Yes.
Thank you, Dr. Weber and Dr. Lidor, for your support in making this happen and making this a success. Yeah.
Great.
Great.